Morning is infant health and immunization, and we're talking to Dr. BNabitt-Stephens from the Harry Medical College and Miss Peggy Halprin from the Metropolitan Health Department. And Ms. Halprin, before we had our break, we were talking about immunization. I think I indicated that April is the month of immunization on a national scale. And let's have you to give us some information about what the Health Department is doing and what it has done in reference to this dealing with immunization.
I'd be happy to. My main involvement with the immunization program at the Health Department has been through their birth certificate registry, immunization registry and tracking system, recall and reminder system, which sounds like a lot. It's efforts that were begun several years ago with funding through the Robert Wood Johnson Foundation to plan and then implement a method for tracking children who are born and reside in Davidson County as far as their immunization status is concerned. It's very important, and Dr. Stephens can certainly speak to this, extremely important that children be adequately immunized, age appropriately immunized against diseases that can be lethal, but which are completely preventable if they have these vaccines at the appropriate intervals. What the Health Department has been involved in through funding, through local funding, and also through grant funding through Robert Wood Johnson, has been in planning and implementing this registry. What occurs is when a child is born and resides in Davidson County, information about that child is entered into the registry. Following that, the family of that child is sent a reminder card at appropriate intervals, at 1 month, at 3 months, at 5 months, and so on, all through the first 24 months of life.
That's every child in the...
Every child in Davidson County, to remind the parent that an immunization or 2 or 3, whatever is due at that particular point in time, is in fact due, and that they should contact their medical provider, whoever that might be, and make an appointment and bring the child in so that the child can then receive this immunization. Folks might, in the community, might have wondered what these cards are when they come in and say, ah, what is this? This is from the Health Department. Well, indeed, it is from the Health Department. It doesn't mean that the child needs to be brought to the Health Department. In times past, the Health Department was much more involved than they currently are in actually giving immunizations. Since the advent of TennCare, folks who have TennCare can now go to their TennCare provider and receive those immunizations. The Health Department does still give some immunizations in their clinics, but not nearly as much as they used to. If we do not get a response from this mailing, then that child will be followed up on either with a telephone call or by a visit from an outreach worker who will try to contact that parent and say, you know, your child is due an immunization. Have they in fact received that immunization? Because they might have, and we just didn't get that information back. The goal is to increase the number of children who are age appropriately fully immunized through 24 months of age. What happens is, or has been happening, is when a child goes to school, they must be fully immunized. It's the law. But there is nothing that says that they must be fully immunized at this early age, which leaves them completely at risk for diseases that are totally preventable until they reach school age. And one of the things that started this initiative on the part of CDC in Atlanta and a part of the Robert Wood Johnson Foundation was a measles outbreak that occurred in, when was it, 87 in New York? Or that was a bad pocket.
And Texas.
And in Texas.
Very good.
And Dr. Stephens may be able to speak to those numbers more than I.
And let us have you to do that, Dr. Stephens, in terms of the information that you have in reference to immunization.
Well, Davidson County in 1995 reached the threshold of our year 2000 goal, which is to have 90% of all the children under 24 months of age appropriately immunized. Our 1995 numbers are 89.6%, so we're just at the threshold of what we were trying to do. Our challenge now is to maintain that level of immunization. We have still, in Middle Tennessee, last year, there were over 200 cases of, a combined number now, of over 200 cases of hepatitis B, pertussis, mumps, and rubella. And all of these diseases are preventable. But if you do not have adequate immunization, then you will, of course, be subject to developing these illnesses. Now, perhaps you say, well, it's no big thing to have mumps. Probably not, but it is potentially lethal to have hepatitis B. We have no treatments currently for hepatitis B. All we can do is prevent it. Several individuals who develop hepatitis B do not recover. They go on to develop either chronic active hepatitis or even liver cancer. So this is a very serious illness. It is a very heartbreaking experience to try to treat a child who has pertussis. You watch helplessly because there's no medication to help them. You watch helplessly as this child looks like they're going to cough their guts out.
Well,
they're coughing so hard.
Some of the symptoms
of whooping cough. They're just this intractable cough, and there's nothing you can do for them.
There's no medication for them.
There's no medication for them. There's nothing you can do for them. They're coughing so hard they can't eat. They're coughing so hard they can barely breathe. So it's very important that we prevent these diseases since we can't treat the disease.
Very good. Now, tuberculosis.
Yes.
Now, does that fall within the infant category? Now, I know that that is a disease that folks often talk about coming back and something that could be prevented and et cetera, but what about tuberculosis? We
do not have a vaccine that is commonly used in this country to prevent tuberculosis. There is actually a vaccine used in many third world countries. We do not currently have never used it, as a matter of fact, in the United States, because we decided we would handle the illness by early identification and treatment. Now, the problem with tuberculosis, and it's a serious problem, is that we are developing strains that are resistant to the mainline treatments. So they are what are called multiply resistant strains of TB. And that's the nightmare for the epidemiologists, because once you start that trend developing, you don't know if you're going to run out of treatment choices.
What do you mean strains that can?
Many organisms have the ability to change themselves depending on what their experience is. So what happens with a lot of bacteria is if they have encountered a certain antibiotic over a long period of time, they develop a resistance or an immunity to that particular antibiotic and are able to then continue to exist despite the administration of that particular medication.
And so even when you give that medication, those
they are resistant.
They're resistant to it, and you're almost at square one in terms of trying to combat that particular disease. Okay, we'll talk about some other things when we come back, and we'll be back with you following this commercial break.